absolutely. There is always an inclination in science and certainly in healthcare to not present things until you understand, have all the facts and know what exactly you can recommend and not. And I think what we're seeing is the necessity of dealing with more uncertainty and being able to navigate with that. Ms. Beck says you also talked about the difficulty of going on and off healthcare. You all kind of alluded to the challenges of the red tape and the bureaucracy, but there is a strong demand from the public now to prevent fraud, make sure that we are being vigilant with every tax dollar that is spent. What things do you think that we could simplify? And maybe this is a longer question that you can answer later, but how can we make this paperwork simpler and yet make sure that we're still protecting, being careful in terms of protecting against fraud?
Yeah, I will say that the threat and fear of fraud is probably much smaller in reality. Nobody wants to be sick. Nobody wants to be disabled in an ableist society. And so I would say things we could do is, I think presumptive eligibility would be a huge start for benefits, and both disability benefits as well as clinical services and community-based services, because there's just such a broad population of folks who are living with this.
Right, right. Well, thank you. I'm out of time, but I appreciate. Sorry, it's a little bit like Jeopardy, where you see someone going to the buzzer. Thank you.
Thank you, John. Senator Smith.
Thank you, Chair Sanders and Ranking Member Cassidy, and thanks to all of you so much for being here. Health is a very personal thing, and so to be in this room with these bright lights and share such personal stories about your lives is really much appreciated. And I really appreciate Senator Murkowski's line of questioning around the kind of the interaction between mental health and physical health and how one fuels the other and how connected they are. So just thank you for your answers to that. I'd like to just take my time to understand a little bit about how insurance, how it's working with your health insurance coverage. And, okay, so there are no FDA-approved treatments for long COVID. And I'm wondering what your experience has been with your health insurance and their willingness to cover non-approved drugs. And, I mean, I'll be honest, I think a lot of times it's hard for people to get health insurance coverage for stuff that we have a lot more experience with. And so would each of you just be willing to talk a little bit about what that experience has been? And I'm wondering if we might be able to learn something from that as we think about what we can do to make this work better.
Yes, thank you for that question. I feel like I will send you a longer story that I think really highlights this issue, but I will say generally on my charts and in billing for my long COVID care, I'm diagnosed with a lot of symptoms, and I'm able to get prescriptions or treatments for those particular symptoms. That again required my specialists to know how to sort of like bill the care that they are providing me. Mm-hmm. And again, it requires a lot of staff time from their office as well to do prior authorizations, all of that. So I do think there's a lot that can be done to validate from the insurance side treatments that are for long COVID and not require dectors to sort of do the back end maneuvering mm-hmm. to get something covered mm-hmm. When they know it's medically necessary.
This is why I hear from providers all the time that they have to have like full-time staffs that are just trying Absolutely. To figure out how to get insurance companies to cover care.
Absolutely, yes.
Right. Ms. Beal?
For me, I think it would be helpful if the insurance companies could recognize long COVID as its own illness, mm-hmm. and then maybe some of those treatments and procedures would be covered more quickly. I've experienced delays with different things that I've needed waiting for the insurance to approve it. One example is I need oxygen at night, and my doctor ordered it in August, but I didn't get it until I think late October. And it was because of my insurance company and the company that was providing the oxygen. So I think, you know, having to wait for something that you need because of whatever conversation the insurance company is having with the doctors, all the stuff that's happening behind the scenes that's taking way too long.
Right.
It needs to be streamlined.
Well, and that's got to have a big impact. You're
Right.
talking about, for example, suffering from insomnia, struggling to sleep, and there you have right there something that could happen that would be useful. Why do you have to wait?
Right, exactly.
Ms. Heim, I'm really interested in your answer to this question. And I'm also wondering, as I understand it, your daughter was able to get connected into a long COVID study at Children's National. And I think often our problems in healthcare, like you could just sort of multiply them for people that are living in more rural communities. And so, you know, it's like just always worse, it seems. Could you just maybe talk a bit about your own experience with insurance and then how it has worked with your daughter, how her care has, I wonder, been improved because she's been able to be part of this larger hospital study?
I would say yes, absolutely. I'm very fortunate that she got the diagnosis so quickly and got referred into this group. And the study is just separate. It's informational. It's its own entity. But the actual long COVID team that they have,
Right.
My poor doctor's office, I mean, they had to not only get authorization for the head of the team, but every single doctor on the team. So it was months of back and forth paperwork. And in the meantime, they were trying to do, they thought she had narcolepsy at one point because her fatigue was so bad. And just to get the sleep apnea test, all the crap that they have to go through to just get the test approved is a nightmare for the doctor's offices. And again, as this is happening, I'm watching my child suffer. I'm watching her sit down in the middle of a grocery store and just say, I can't go anymore. And meanwhile, I'm waiting to find the answers. So yes, that's very frustrating.
Chair Sanders, I often feel that our insurance companies are designed to figure out how to deny care rather than to provide care. And I think that these stories illustrate what that means for people that are living with long COVID.
Senator Smith, you were exactly right, and that's why I intend to bring the major insurance companies here. These companies make tens of billions of dollars in profit every single year, and there are very